Can you please tell us about a strength and a weakness as a nurse?
Yeah, I would say that a strength of mine is that I have really good communication skills. If I don't know something, I'm for sure going to be asking a question, and I really find it valuable to be constantly checking in and looping in with my charge and my team members, and also my patient and their families, and just to always have open communication with everyone if there's an issue or a problem, to making it known and resolving it right away. I'm also a very big team player. I'm constantly asking my colleagues if they need help or if I could do absolutely anything, because I know at the end of the day that one day I'm going to be the one that's going to need the help, and that we all just have to be in it together. And I would say that additionally, I'm very reliable. Something my managers in the past have always told me is they really appreciated that I just arrived to rounds early with a positive attitude and fully present and ready for the day, and that I did my tasks as I was told with no issues, and that I clocked out on time. They also said that I was very teachable and open to constructive criticism, and that they really saw that I worked well with others. And I would say my biggest weakness is that I have limited experience. And I think this just comes naturally with where I'm at, still relatively new to the profession. And I'm actively working on this weakness by engaging in as many learning opportunities as I can, always asking questions and really trying to figure out the why and how behind what I'm doing as a nurse, and not just going through the motions. And yeah, so moving forward, I'm really just striving to get in as much experience as I can, and to develop my nursing skills.
I think my strength is like my ability to listen, especially to my patient, especially when talking to patients. Some of my patients said the most frustrating thing that they experience is when they felt like they're not listened to. So I think that is one of my strength. My other strength is that my ability to work in a team. I'm a very good team player. Not only that I am very accountable with my own job, but I also make sure that I also offer support, especially if when I see my colleague is drowning, I always jump in willingly and give them help. I offer help. And another thing is that I am very coachable, and also I'm very receptive to constructive feedback. I always make sure that I use this constructive feedback with a growth mindset that so I'm be able to improve myself and be a better nurse. And one more thing is I am very curious. I always ask questions if there's anything that I don't know, if I'm unsure of. I always ask questions. I'm never shy of asking questions, especially if I want to make sure that this is for my patient safety. So I always ask questions. And for my weakness, I think one of my weakness is that being a new grad, sometimes I feel unsure and I don't have that much experience compared to others, but I compensate for this weakness with my willingness to learn and making sure that I always study, and always make sure that I don't just focus on one thing. Make sure if there's a skills to improve on, I always improve myself. And yeah, for example, asking more experienced nurses so they can teach me so I could be efficient more in my work, because I know if you're efficient, you can improve the quality of care that you can provide to your patient.
If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview. What do you have for, like, the strengths are easy, but what do you have for the weakness?
I'm just gonna say that my weakness is that I'm a self-critic. I put 110% to everything that I do, and every time that I didn't meet my personal standards, I tended to get a little bit hard on myself. So instead of getting too hard on myself, at the end of every clinical day, I wrote 3 things down that I wanted to work on that day. And I also wrote 3 things down that I'm really proud of myself doing that day. And that really helped keep up my motivation. And then the next shift, I took out those 3 things. And those 3 things were those targets that I would really focus and grow upon and learn that day. So at the end of each day, almost every single time I completed those 3 things. And if I didn't, then I would add that to my next day list. And that's just something that really helped keep me in check. It kept me motivated by showing me how much I truly was learning each and every day. And it also helped target the areas that I did need to work on so I can solidify my skills in those specific areas.
For strength, I think one of mine would have to be that I'm very curious. So I always want to know the why behind things, which I think is a huge deal for nurses, because we should always know the why behind why we're doing something. And it allows us to stay one step ahead of our patients and to kind of anticipate things. And it also allows us to never stop learning, which we need to because our career is evolving all the time. And for a weakness, I would have to say that I'm probably a big self-critic, and that tends to lead to some negative self-talk. And I know that's poison. That's not good for anyone. So I've done a lot of self-help on myself, like reading books about it and podcasts. And I found that journaling my accomplishments and my goals helps me stay present in my future and what I have done. And it allows me to focus on, the future and the good I have done.
Just so you know, one thing that I've seen new grads do is at the end of their shift, they write down 3 things that they did really well and 3 things that they want to do differently going forward. And then like, that's it. They're not allowed to like ruminate.
Yeah.
And like, they'll be really like quick at like, oh, I did this wrong, this wrong, this wrong. And it's like, but 3 things you did well. And they're like, oh, I don't know. Like, I'm like, come on.
Yeah.
They don't want to say it because like it feels weird,
Yeah.
Yeah.
So journaling definitely helps a lot.
Yeah, you want to, because the way you told it, it almost seems like this is something that you're like still working on with the weakness. When you tell a weakness, you always want to make it sound like it's something that like you have a tendency for, but because you know that about yourself, you found a way around it. So you could say, just like frame whatever your process is, just frame it in a way that like, this is what I found works for me. Can you please tell us about your biggest strength and weakness?
So I would start by saying like my strength would be the time management because of COVID and flexibility and adaptability. And I would say like on the nursing floor, because of our limited COVID experience, I would always try to like just be a sponge and learn as much as I can, say yes to every experience that I could do, and to always just keep an open mind, because even though there's like a lot of interventions and there's many ways to do it, it's important to just keep an open mind because every nurse can do something differently. And I'd say one of my weaknesses would be if I would have like a bad day, or like say if the patient like passes away, I could take that emotional baggage home and it could affect the rest of my day. But I would also say like that ties into my strength because I've learned the importance of like self-care, and it's important to debrief with somebody, whether it's a classmate or your parents or a coworker. I would say something along those lines.
It's important to do what now?
To like debrief with somebody to let them know how you're feeling. Yeah, I would say something like that.
That's fine. Just kind of make it sound like it's a problem that like you used to have, but like you found something that works for you.
Got it.
Yeah.
Okay.
Just because that you don't want them to think like if you have a patient that like has to go to ICU or something, you're going to be like out of the game for the rest of the shift, you know?
Mm-hmm.
My strengths, I'd say I'm a team player and I've learned the skill from various sports, from working in environments where I have to collaborate with one another, just in school. I think that working as a team, you're going to get so much better, so much more done, and you're going to be able to just give a higher level of patient care. think more heads are better than less than one, and just having everybody's knowledge, input, and just learned experience will help you grow and become a better nurse. Another strength I would say that I have is I'm very open to criticism, constructive criticism. I always want to be a better nurse. I want to provide the highest level of a high standard of care to my patient, and I always value patient safety. If there's another nurse who knows more, who's willing to impart some of her wisdom on me or to help me become a more efficient, safer, or better nurse, I want to become that. And I'm so open to any suggestions that any of the nurses would have for me. Another strength I would say I have is that I'm a very hard worker with a good work ethic. I'm task oriented. I really, really like getting things done, making sure that my patients are cared for, that they feel cared for, that that they don't go without anything, that whenever I leave the shift, they felt that they've had someone who's really walking alongside them and cared for them the entire time. And I'd say that another strength I have is communication. I feel that I'm good at communicating with other team members, whether that be respiratory therapists, CNAs, other nurses, or doctors on the floor. I think open communication is such a vital role in nursing, and it's going to be what makes or breaks your nursing practice. And then
real quick before we go to weaknesses,
yeah,
don't forget this. So sometimes new grads are in a negative way described as task oriented, meaning like they go in the room.
They only want to do the task. They don't want to like care for the patient, right, or like do extra stuff.
Right. They're like task oriented in the sense of like, they know they need to pass the meds and they need to, so maybe let's say, I need to give this core egg, I need to take the vitals, but they don't connect like, oh, well, the systolic was 85, so maybe don't give the core egg right now. Like they're just so oriented that they just like can't notice anything else, right?
Yeah, that makes sense.
Or like they're desatting, like I need to call a rapid, and then rapid comes in and they're like, hey, the oxygen isn't plugged into the wall. Like it's just
tunnel vision.
Tunnel vision. That's what it is.
Yeah.
So self-describing as task oriented, I think if they've heard someone described as that negatively before, they're like, I don't love that. So other words, you could say you found you really enjoy working in a fast-paced environment, or
that's a way better way to putting it.
Yeah. And I think kind of what you were talking about too was like being detail oriented. There was something you said about making sure that your patients aren't left needing anything. It kind of ties it back to the thing about like, making sure the little details, like that their hair is taken care of. And, because you like working in a fast-paced environment, if, you've learned that when you're able to manage your time well, it leaves time for all the little details that you enjoy doing to, really take good care of this patient as a person,
that makes sense. Yeah.
Frame it as that more. Just the words task oriented is kind of, it has like a connotation that they might have like a different idea about, you know what I mean?
Yeah, kind of in relation to your story about like nurses just wanting to get stuff done. I kind of, as I was saying it, I was like, I don't know if this is like the best word to describe, but I like to make sure that all the meds are given, but I care about other things, but I get what you mean. Yeah.
So what about weakness?
Weakness, well, my biggest weakness I would say is as a new grad, I have lack of experience. Obviously, I have experience on the floor under another nurse, but being a new grad, I haven't had a job yet, and I just really need those experiences as a nurse. But one thing is that I feel that I'm really open to learning now, and that I'm really just ready to be the best nurse possible and learn as much as I can. And another weakness I have is that I am a little too detail oriented sometimes, and I feel that from time to time slows me down. But I'd rather just be super careful and make sure that everything is right and perfect for my patients rather than rushing through something and being sloppy.
So let's just pick one. I would stick with the first one. And then the game for the weakness is basically you talk about it like it was something you used to really struggle with, and then someone gave you this amazing piece of advice, and now it's really helped you because you're able to do this thing now. So like, what was it you were talking about? Oh, that you lack experience. You could say that you had a clinical instructor that really encouraged you to seek out the most intimidating skill at the time. So there was a time that I hadn't done IVs yet, and I was really nervous to put an actual needle in someone, because it, might be painful. But she said, when you feel that, to kind of see it as an opportunity for growth. So I signed up for a time in the skills lab to practice first with the mannequin to make sure, because I am detail oriented and I want to take good care of my patients. I really want to make sure that I understand like the procedure and the policy and everything before I would never just wing it on a patient. But once I felt comfortable with the skill, knowing that I'm doing it in a way that's evidence-based, I would let my nurses know if there's any IVs that are needed today. Is it okay if I try, because I need more experience with this, and I'd love to learn from you the tips and tricks that you use that help you be successful with this. And so they knew that anytime someone needed an IV, they'd ask me. And it basically really just taught me that, because I started to get better at IVs, and the better I got at them, the more confident I became in them. And then I was able to get even better at them after that. And so I shouldn't say basically, it taught me that anytime, there's a new skill that seems intimidating, I'm going to talk to my preceptors about it and see how I can, in a safe way, get as much experience as I can with that thing to kind of slowly broaden my comfort zone. Because I don't have experience working on my own as a nurse yet, but I think it will help me to grow as a nurse if I don't avoid those situations that I'm not comfortable with yet, to really be open to learning and to see them as opportunities to grow and to learn. And it's been fun bonding with my preceptor or the nurses when they know I'm excited to learn about something and they're able to share all of their hard-earned knowledge. It's just been a really much more supportive learning environment than just shying away from the things that are intimidating. I feel like that's a really long-winded answer, but something kind of
No, that was good. Yeah, no, I have a similar thing with I really didn't want to do IM injections for the longest time. I don't know why, it just scared me. I wouldn't say that, but like I was so scared of them for
you
some
could totally
reason.
say that.
Yeah, I did that, and then I signed up for a flu clinic, and by the end of the flu clinic, I loved it. Was so fun. Like I felt like I was really good at them. So yeah.
Totally talk about that.
Okay, I'll talk about that. Okay.
Because that's the thing is,
Yeah.
I was like, I wish she had said, because there's people who have said like, I want to work in P, or what was it? I really wanted to work in OB. I didn't get a preceptorship in OB, so I found volunteer opportunities in OB. I became a doula.
Oh, awesome.
Like she sought out these opportunities. So you could say like I was really uncomfortable doing IM injections, so I knew the only way through that was to learn procedure of how to do it and practice in the skills lab on a mannequin, but I really needed to get experience with patients. And so I signed up for the flu clinic, and just basically because what you were saying, you were like genuinely animated in your face, which I think is not only like helps them bond with you, but it's kind of like more entertaining because they have weeks where they have to listen to everyone just give the same old bland, like flat answers. Like the person who can actually make them feel like they're talking to a real human is like such a breath of fresh air,
Yeah, definitely.
Doing
No, I
these
definitely get
back-to-back
that. I could just get over my yeah. Oh yeah, no, I looked at their sign up list and I counted because I'm crazy. And they had like 200 spots like filled, and I was like, oh my gosh, yeah, Survey Monkey, you can just see. So I just was like counting, and I was like, okay, we're in the hundreds, 150s, 200s. So
Wow.
yeah, definitely we'll need to have some energy.
Yeah.
Yeah.